tree, got the hemp, got the flare. I'm gon' lean in this chair, about to put this in the air. A little bit of that best way to smoke in the air, nigga. A little bit of that best way to smoke in the air, nigga.
What's up with y'all out there? This is Best Way to Smoke Unfiltered, and I'm Big J. Make sure you stay elevated at all times.
What's poppin', everyone? This is C-Pop, your professional hype woman. Happy Monday. Happy Monday. How's everyone feeling today?
Happy Monday. I'm feeling good. I'm feeling great. You know what I'm saying? Oh, man. No, I'm feeling good, though. How you feeling?
Same. I'm feeling good. I'm feeling great. You know, been hopping on from plane to plane, but the show must go on, you know. One more time for Men's Mental Health Month. We gotta put that back out there, you know, because today we got
Mental Health Month.
A very special guest today. You know, Best Way to Smoke's always trying to touch on mental health, not just for our community, but for the men, you know. So we have health administrator, Miss Tamira. Help me welcome her.
Hello. Hi.
Hey, how you doing?
Hello, everyone. Hi.
All
Nice to meet
Welcome
you
to the
all.
chat. Welcome to the chat. Thank you for your time today. I appreciate you popping in on us during a special time this month that we're trying to highlight.
Yeah,
Yes,
I'm happy to be here. I'm happy to be here for a very good cause.
Facts. Yes, we definitely appreciate you popping in.
For sure. And I know you in mental health care, I know you got a lot of things you probably moved and grew through, and a lot of different areas that you touched on. Can you give the people a little bit of background about what you do and why we brought you on here today?
So I started in behavioral health about 13 years ago. I've always been in healthcare, but found myself working at an eating disorder facility in Atlanta, Georgia. And at that time, I had young girls, and it just brought awareness to me of eating disorders. And then I just really dove into behavioral health stuff. And from there, I stayed there for a long time, and I left and kind of ventured off into doing my own thing as far as just medical billing and insurance contracting and authorizations and all of the healthcare things that people need to have taken care of in order to even get the claim paid for you to get the services. People don't understand that piece of it is super important because the providers have to get paid and the people want the services. So I'm like a liaison between a patient and their insurance companies to make sure that they get their services paid for. So after, just kind of being in that, I moved over to substance and alcohol abuse. And currently I'm more in behavioral health stuff that is touching on autism. I have multiple autism centers that I run for their revenue cycle management, meaning making sure they get paid. So I've collected a lot of different just people in my life who are amazing people who are healthcare providers, therapists, family therapists, substance and alcohol abuse counselors, all kinds of people I've encountered. And I've seen how it really can change people's lives, because in those moments, I'm talking to them about money, but it's a piece of something that they need to understand in order to get the treatment. So I like to get that information out there as much as I can, because people, they have insurance and don't really understand what it does or how it means versus Medicaid or commercial insurance, or there's a lot of funding out here to pay for services when people think that there isn't. There is.
We like that.
Yeah.
Right. And then in the realm of like the billing, you know what I'm saying, and collecting money for the providers, are providers burning out more from the trauma of the patients or from the fighting insurance companies just to get paid?
Yeah, great question, because no, it's the fighting of the insurance companies. The people that I've encountered, and you have bad therapists, you have good therapists. I always tell people, if you're looking for a therapist, if you're vetting them out, it's like dating someone. You're vetting them out. You're trying to see what is the best look for you, and don't stop at seeing one person. If you don't like that person, move on to the next. Find someone who you can connect with, because a therapist really should be somebody that you are dealing with kind of like forever. Like it's about management, not about just trauma, fixing trauma. So I would say the insurance companies are giving us a run for our money, especially in this political climate. And I'm an advocate for that because they're wiping out so many different things and preventing us from getting the things we need to stay sane and be in this world, you know, as productive citizens. So, yeah.
I do want to point out.
Companies.
I'm sorry to cut you off
No,
because
it's
I do want to point out something that you just said. You said it's not. You said it's about management, not just trauma.
mm-hmm.
Break that down for us real quick.
Yeah. So, me working in this environment, and even though I'm not a clinician, I've noticed that those people who are consistent with their treatment, those are the people that more likely get better or just become more whole. I'll just say that. The people who are inconsistent, you're going to get inconsistent results. So it's management.
And that's that.
Yeah.
That's that. You know, sometimes, easier said than done, right? But at the same time, not everyone realizes that it's something you have to be consistent in. It's not just a 1-2 time, whatever.
Yep.
Something like you're not, I don't know about everyone else on this line, but you're not getting out like in one session.
Nope.
An actual, like you're not digging through like real life in like an hour session. Like you need some time. Maybe there's different ways to tackle this out of like people receive things differently, right? How you're talking to your last patient might be completely different how you talk to your next one, and so on and so forth. So I love that you brought that up, that it's not just trauma, like it's really like
unpacking.
It's unpacking.
Yeah, working in that world, you hear that word so much because that's what they're doing, unpacking.
Right. Right. And you brought up that it's even harder wrestling with the insurance company in today's political climate.
Yeah, it's bad. It's tough right now. Yeah, no, I have no problem, and I'll call it out as it is. We have the biggest insurance company in America is United Healthcare. They run a lot of things and people don't know how they really run things. And I don't know if you guys remember, there was a shooting in New York not too long ago where a kid went up to, I think it was like a building and shot one of the United Healthcare CEOs.
Oh, I didn't even know about that.
Yeah, it was a big deal in healthcare world. But kind of one of those John Q, if you ever seen that movie.
Yeah, I've seen that. Yeah.
Okay. So, but then
for those who haven't,
yeah.
Oh, yeah, she don't watch movies. Yeah, I forget.
John Q is amazing. If you don't watch movies, you got to watch that one. That's a good one. But yeah, like they're a really big company and they're doing things that are just not right. I mean, because I work in it every day. And they are making people like myself have to work really, really hard to get these people their money. So they got to put out more money for manpower for people like me and my team to do for them. And then they have to, pay for all these different tools to fight the insurance company. And the insurance company are using tools to fight them. And it's just a battle. So the care, you know what I mean? It could help. Someone could actually not get the services they need because you're fighting the insurance company. If something's not authorized, they don't do it, basically.
Right.
Yeah. So that's the fight that I'm in like every day.
Right. So like why does the healthcare system still prefer to pay for mental health crisis rather than prevent one?
So that's the thing. I feel like it's never been like that. The insurance company is we had to fight for so many things, cancer stuff, the pre-existing thing. There's been so many things we've had to fight for. The average American is not really paying attention to that unless you get sick. And now you're like, oh, they won't pay for this. And I've been paying my insurance and why, those questions. And that's why I think we all should, just like I think we should all pay attention more, read more about politics. We should do the same thing about healthcare because it's like, we all use it. We all are going to have to use it at some point in our lives, Sure. So, yeah.
Okay, with the autism care. So autism care doesn't fit into a net like type timeline. How do standard insurance checklists fail the families and providers?
Mm. It's horrible right now, especially for autism. So autism is a new specialty. It's called ABA, Applied Behavioral Analysis.
Okay.
So if you ever see anything that says ABA, those are autistic kids getting the help they need. They also have adult centers as well, but usually it's a center, and they're kind of like little schools, to be honest.
Okay.
And there's therapists working with these children all day long, and their moms have to bring them there, and their dads and their families, and it's a lot. It's not like regular school because you're dealing with an autistic kid, and a
Right.
lot of us have grown up and had autism and didn't even know it, to be honest.
Hmm.
But it just became a payable thing. I don't quote me on this, but maybe like 2010.
Okay.
Mm. And what are some of like the symptoms that you see from like autism? I know you said some people grew up with it and didn't even
Hmm.
know, so what are some things that we might see or we might overlook in someone who is autistic?
Yeah, that's why I tell people, like, when you're out in public nowadays, it's just more likely that you may see a kid and you're like, why are they yelling? Why are they screaming? They're bad. Like back in the day, that's what we would say. But you never know. That kid might be autistic and they're
Hmm.
nonverbal, and that's why they're doing those things. And their parents are struggling to get the resources they need to pay for the services to get this, so they can manage that child, and that child can grow up to actually still get a job or have a kid or you know live a life. So it's a really big deal. And in the Black and brown community, I mean, we have children that are autistic, and we're
Right.
and it's like one of those things where we're already low on the totem pole for so many other things. Now add another layer on top of that. So yeah, so I would love to get resources out for people who have those things going on in their life and don't know where to turn.
And something you said that's kind of interesting too, though. A lot of people don't know that their kids have autism or have these, mental health issues. They just, figure they bad or go lay
Mhm.
down, go
Yeah,
stay in
go
the
take a nap
corner.
or
You know what I'm
something.
saying?
Exactly.
Yeah,
No.
that's a trip. I believe that, therapy, and going and sit down and talk to somebody, whatever your therapy circle is, I think it's important to have that, whether it's a professional or whether it's somebody that you can just be able to, get your feelings off to, though. It's very beneficial because holding stuff in, when that one day you're just gonna explode.
Exactly.
Mhm.
And we keep seeing it time and time again. I mean, yeah, it's a wild time right now. So
You know.
Why do you feel like some individuals struggle with receiving care, like despite there being programs available?
hmm, because all the information is pretty hidden, and of course, usually if a person is having some mental issues, like some serious mental issues, right? Um, they're not even in the right frame of mind to go find those services, and they might keep getting locked up, keep going to jail, keep going into rehab, but not really fixing the real problem, because the real problem is even deeper than the alcoholism. I mean, I've seen it all, because usually when a person is in substance and alcohol abuse, I'll see that they also have an eating disorder. It's like all the things go
Hmm.
hand in hand. It's like it just starts to kind of tumble into just something that you can't control if you don't start to fix those core issues. Um, yeah. So
Quick question: how do you recognize somebody with an eating disorder? Because I know they're not all heavy set or big. So how do you recognize that though?
it's eating habits, and like a lot. I mean, I'm not a clinician, so I can't say, but I know for a fact off of just looking at paperwork that I'm submitting to these insurance companies, they literally have all of them always have the same type of symptoms of what they do, just different things. Like
Okay.
say for instance, some people will just take pictures of food, just take pictures, but they won't eat,
Hmm.
stuff like that.
Right.
And people go to
Mm.
school for this to learn about these things so they can help these people, because I've literally witnessed people die from eating disorders, young girls, 15, 16. I see them one week and the next week they're gone.
Mm.
Hmm.
Do you feel like there is more, and forgive me if I sound a little ignorant in this topic, but do you
No.
feel like there's more like individuals who suffer from overeating or undereating, or what?
I don't know the
I can't forget
statistics
me.
on that, but I can say based off of the facility that I used to work in, I saw more people who were anorexic.
Malnutrition. Yeah.
Yeah. And there was a few bulimia, which is when you overeat and do things like of that sort, but more anorexia than anything. And
Mm,
a lot of times coming from people who are like just over the top about sports, you know, young ladies, cheerleaders, stuff like that.
mm.
Yeah.
Would you say as far as people that deal with that, is it more women that deal with them kind of issues than men or
I
boys?
it was always honestly when I worked at the facility, mostly women, but sometimes there would be females, and usually sometimes there would be males, and usually when it was a male, I would notice that a lot of times they would be like, gay or bisexual or something like that, and I asked that question because we actually had a gay um a therapist, and he saw all of those patients, and he was really good with them. And I asked him, I'm like, what is the correlation with that together? And he didn't have any answers for me, but I think that there is something with that as well.
Hmm. Yeah, that's interesting. Let's
I
talk
think it's
about.
the never mind. Have me talking like a doctor. I was gonna start
No,
putting my
no, get
own
it off, Pop.
diagnoses
Get
out
it
there.
off.
I was
Get
gonna say
it. Get it off, Pop.
my first thought is just like the pressure that society puts on us to look a certain way,
Certain way.
or to hold yourself a certain way, or like, when you sit you have to, your stomach got to be flat, and like all these
Hmm.
things that it's like, it's not like, no.
Yeah, and social media is not helping that with younger people. It's just getting
Hmm.
worse.
Hmm. It's not. There's not. I overheard a couple like young kids around my job talking about how like they were like exchanging like weight loss medications and things
See.
like that, and it was a young gentleman who's always in the gym, like he's always talking about it, and he's thin. He actually got a really good body on him. He's thin, he's like buff in certain areas, like young, full of life, and he's trying to be on weight loss whatever because he wants to see his veins in
Yeah.
his arms. And I'm
Yeah.
like, I stopped him real quick. I'm like, excuse me, please, 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 you are way too young to be having like, what do you mean you want to lose 5 pounds off of weight loss medication? Like,
Mm-mm.
you don't even know what's in this stuff. You don't even know who you're getting it off of.
Yep.
Like, what are you
Man,
doing? Like, no. And he's just like, I want to see my veins. I'm like, please no. Like,
I hope he listened to you.
It's all
he
kinds of
didn't. I can already tell he didn't.
things like that are going on because you're looking at other people and thinking that's what I should look like, but it's really unhealthy. But
It was a
yeah,
group of them. It was like 3 or 4 of them. I was like, guys, no. And they all looked great. All of them.
yeah. I really
All
I
looked
would
great.
when my girls were growing up, because I worked in that environment, I always was just paying attention
Hmm.
to, are you eating, and I was over the top about it, and I'm always talking about it now with other people because I work in that environment, and I didn't realize how, yeah, it's everybody, even older people had it,
Hmm.
who
Oh
had
yeah.
had it for all their lives. There was people there who would come that were older, and they just got it, fell into depression, and now they're back with an eating disorder again. Now they're not eating, or they're overeating, or whatever it is, but to the point where it can kill you.
Mm.
Yeah, that's deep. That's
Yeah.
deep. That's deep. So, is there any resources in that realm that you can tell people about?
Yeah, so I do have a list of providers, and these providers that I have basically are providers that you have to, specialties are different. So if you have a child, you're thinking you want to get them tested for autism, that's a whole different thing. You have to go straight to your primary care doctor. You have to get referred out. It's a whole process. So you're really not just going to go find a therapist for your autistic kid. That is more of a medical thing. You
Okay.
transition from the medical piece from primary care and referred out to an ABA center. But as it relates to things like eating disorders and substance and alcohol abuse centers, a lot of therapists, they specialize in those are like the main things. If you can get you a licensed therapist, usually that's a part of their curriculum of what they do. Now you can decide to choose specialists, so you only want somebody who only talks to you about substance and alcohol abuse. But usually they also can do family therapy, and those things are all part of it. To be honest, marital counseling, all of those things are a part of it. Usually, it's like even if you're getting substance and alcohol abuse treatment, you may still need to go deal with somebody with your wife, or you got to go deal with somebody with your mom, because that's the reason why you're drinking, that kind of thing. It's usually, like you said, having a therapy family, a group, and sometimes it's your therapist along with other people. We just all got to know that we got to have people.
Yep.
So I have this therapy for Black girls. I got these resources from a couple of young ladies that in Atlanta that are amazing. I watched them grow from interns. They worked at the eating disorder facility with me, and they all both own their own practices. Amazing women. So I'm definitely going to give that information out, because they're both seeing patients now, and they will direct you on how to get money to pay for your services if you don't have insurance, because some people don't have insurance.
Yep.
Oh wow,
that's dope.
That's right.
And we'll definitely when we definitely gonna clip this part too, though, and we'll be able to share that information, like put the information in the video.
Perfect.
Too. Yeah.
Perfect.
Yeah. So look, let's talk a little bit about the mental health and the justice system.
Yeah.
Okay. So when treating inmates, who is the administrator's true client? The person needing healing, or the prison system waiting for compliance?
So I don't know much about the healthcare system as it relates to mental health in prisons, because from what I can tell, is non-existent. If somebody is in prison and they're bipolar, I've never heard anybody saying my therapist is coming to see me. But should they be? Yes.
For sure.
And that's the problem. But we have to pass laws, and we have to fight, and we have to talk about it, and we have to do these kind of things so that is the case. But of course, there's all these resources for people after the fact. I know a couple of guys who went to prison for 10 years, both of them, and started nonprofits when they got out, because they did the right thing when they got out. For whatever reasons, they turned their lives around, and I witnessed it. And they reached out and helped other people. That's where we're going to get as a community, is to help each other. So when it comes to the prison system, they're not going to help them. Yeah. That all that has to be done when they get out of prison, and by that time the damage is done.
Right.
So
Right.
So we're working backwards.
Right.
Literally.
But you got to have hope. So you got to keep going. And we all have those stories of family members. Somebody knows somebody who has been broken by that prison system.
Facts. I mean, just speaking from experience of experiencing it, it's not no help for inmates and stuff. And you barely can go to school in certain prisons, because it's always things going on, lockdowns and all kind of stuff. So I think just being able to keep shining a light on that aspect, though, it maybe it'll help. Maybe getting down there, getting some bills wrote up that can help people in prison, because it's supposed to be rehabilitation, right? But that shit is not rehabilitation. But it can be if you depending on the person. But if it's a person dealing with mental health issues,
then you need professional help.
Exactly. And most people are not going to look at it like, damn, I need to go talk to a therapist, or when I get out, and it leads a lot of people right back into the same direction of what they were doing before, though, really not having no understanding of what they going through mentally. Yeah, it's deep.
Yeah. Yeah. I don't know. I just thought of something as you're saying this. I don't know if there's I'm pretty sure there are some groups out there that would do these kinds of things, go into prisons and actually counsel people. And I'm not talking about just, because I know churches can do that, but actual professional counselors, I don't know. And now I want to know. if that even is something that they can do. Because if it is, even if you did that pro bono, like as a part of your group, like you have a group of therapists and it's 10 of you, and 2 or 3 of you guys go up to the prison and see people and make that reach out to let them know that there's help, and try to help them while they're in prison, not after.
There's like mentorship programs and things like that, like groups that they
within
like,
there, all together within there. Yeah.
Like there's like different programs and stuff that they'll like allow. I know with the like the younger kids too, they'll like allow certain like mentorship programs. But again, you gotta who you know or whatever.
Yep.
It depends on what prison you in too, man.
It depends on a lot, right? Man. So if they want to welcome that, but that could just be. That could be people that it does. I'm not saying it's just therapists. I know it's like people can sign up for a mentorship to be a mentor, and then if they get approved, they go through it. But as far as it just being for like healthcare or therapy, like I haven't heard about it.
Yeah, but it's like if you think about that would really. I mean, I know they have those programs like you're saying, but to have the type of help that you would get out on the streets. Just come to you in there could make all of the difference of what that person does when they leave. But all of these things people have to get together. It's the same. Have to get together and do it.
Right?
Because they have money for stuff like this. They have money.
Sure.
One thing about that always just sticks with me too when we're talking about like mental health and the justice system, the prison system, is like the young boys who are in there from like 14 to 25-ish, like that time. And those who get hit with like long crime, like 3 to 5 years, whatever, like it might not seem like a lot for an adult. Like that's a long time for a kid. You know what I'm saying? Like, especially that time frame, like that is when okay, you might have a teen who's acting out or whatever you want to, they're out doing whatever, but they're not adults, for one. For two, you're thinking about that's like when your brain retains the most and you're like like your frontal lobe's not even developed yet, you know what I'm saying? So you're stepping into like learn about like setting into who you are almost in a way, right? Like you don't have time to really develop, like your brain is developing in prison. So while you're at this standstill, dealing with whatever you're dealing with behind bars, survival, you don't really have a fair chance at life. Like you really don't get a fair chance at adulthood. Like hopefully your support system outside is strong, and wants better for you.
Yeah, those are formative years, and just like you said, that brain is it's developing in there, and it's gonna just stop. And they're gonna get out, and they're trying to figure out what do we do next. That's a real passion of mine is to somehow do something, and I really don't know exactly what to do, but just working in mental health, I'm like, okay, somehow I'll probably get onto that side, because that is kind of like my passion. Because I have people that I know who have gone to prison from the age of 18 to 25, like you're talking about. Not 1 or 2, like 5 or 6.
Right.
And people think, oh, you're out now, you're grown. No.
No.
No. That's not how it works. That's not how the human body works.
Yep.
Yeah, there's that's true for the overall. Sometimes there's exceptions to the rule, though. I done seen a few guys, come out of the prison system, go in young and come out and get into things, and to where they're succeeding in life. Started a family, doing the things that they're supposed to be doing in life. But there's more cases of that not happening, though, for sure.
Yep.
We love the exception.
Yeah.
We love the exception.
I would agree. Like I was just saying, those 2 guys that I know, like they started nonprofit, and came out swinging, like, making all of these different men join in and help others, and it got pretty big. And this was back in Atlanta, but yeah.
You got to direct us to that nonprofit.
Yeah, I'm gonna reach out to him because I got his number.
For sure.
Yes, yes.
Mhm.
Have you seen any mental, like a correlation between mental health challenges and incarceration? Like, what are some of the challenges that like you've seen?
Yeah. So from what I have witnessed is substance and alcohol abuse. I mean, usually that's what got them there, and then now they have to transition out of prison and work on an addiction because they drink in prison. Like they do.
That Pruno, yeah.
They do.
Right.
So it's not
nasty.
I always thought like, oh, well, they're gonna be so clean when they come out because you haven't drank and you haven't smoked and you haven't done nothing. No,
it goes down. Yeah, it goes down.
I did not know that.
Yeah.
It sure do.
I just learned that. So yeah, because I was working for a pretty big substance and alcohol abuse center. Well, they were actually one of my first big clients, and they were in Colorado. I don't know if you guys know, but they have a big population of drugs and alcohol and homelessness. They do. And so they're really big on the providers work with the justice system. So everything, even the billing and stuff some of the stuff is connected if you want to get those patients, and basically they filter those patients to you. So that's what I did like about Colorado. Every state is different, and we got to always remember that. Every state is just like you said, every prison is different. Every state is different when it comes to mental health.
Mm-hmm.
So your Medicaids are different. That's why some people rather live in certain states.
Mm-hmm.
Facts. So go over that one more time. So when you leave the prison system, they had certain patients they would filter out through mental health.
They did.
Oh, wow.
So basically you would get you would be on a list. Like our providers were on a list. So as they were like in court, and the judge is saying, okay, listen, we're letting you out, but you have to pick one of these providers. And one of those providers would be the people that I did all of their billing and AR for. So they would pick that provider, and they would automatically filter them out to go to that facility to get help automatically off the rip at their court date. And they set them up with insurance and all that. So if they didn't have insurance, of course they usually didn't. So they get them with their Medicaid started and everything. Like that's because they're trying to prevent people from being homeless and on the streets.
And that was in Colorado.
They
need to do that everywhere.
Exactly.
For sure.
And then our providers also had to kind of like our medical documentation and everything. We had to kind of like allow the court system to know that this person is getting treatment. I mean, there's HIPAA law, so you can't really tell them everything, right, but just to let them know that they are getting the services that you referred them to us to get, that kind of thing. So it was a communication with their PO, and it was a communication. But we were real mental health providers. I had never saw that before. I was like, oh wow, this is good. But that was in Colorado.
Yeah, that is definitely a good thing. It kind of made me think about on a substance abuse level of Portland, Oregon, like how they what a couple years ago they made it legal for them to do all kind of drugs out there. You know what I'm saying? To where the police is not tripping. And in my opinion, that's not beneficial to people that's dealing with a substance abuse problem. It just kind of keeps them going.
It's not.
Man.
It's not.
They just allowed them to
do whatever.
Man. And I think a lot of people don't take mental health serious. You know what I'm saying?
They don't look at it like health.
Right. And I'm gonna say, like, especially men, like us as men, you know, like me being a man, just being able to voice certain things and certain feelings and emotions and stuff like that, and then not feeling like a punk, you know what I mean? Or you know, your woman or however looking at you crazy and stuff like that. I'm glad I don't deal with that personally. and I have a tight circle, you know what I'm saying, with family members, a lot of my cousins, my brothers,
Awesome.
and stuff like that, to where we all congregate and we talk about a lot of different things, and sometimes it gets deep. It made me think about something. One of my cousins' dad passed away, you know, last year, right? And we was all sitting in the house. It was probably about 7 of my cousins, and we was just talking, and we all was kind of going through some of the same stuff mentally. And it was just a trip that we just sat there. And I'm like, I said, we got to start doing this more, y'all.
Yes,
You know what I'm
yes, like
saying?
that. Yes, yes,
Yep.
yes. I like
Yep.
that.
Yep.
Yes.
I remember that story, Big J, and I'm glad you
Yep.
brought it up because I was thinking about how to bring it up without violating. But that always sticks in my head, like that. It was how you said when we all came together, we all were kind of going through the same shit, and it's
Yep.
like, yeah, you know, like yeah, this stuff, some like life be life in. It's
Right.
not so far fetched like that. The next person is too good to go to. You know what I'm saying? To have some shit go on or whatever. Like we're all
Yep.
human at the end of the day.
We are all human at the end of the day. Agreed.
Most definitely, most definitely. So we gonna take a quick little shift, real quick though. We're gonna take a quick break.
Okay.
Let's go.
These niggas talking out of their neck. Don't put no coffin out of your mouth. I'm way too paranoid for flex. Hey, let's get it, bro. DOT, the money, power, respect. The last one is better. Say it's a lot of goofies with a check. I mean,
What's up with it, man? This is 900 Radio. So you know we've been keeping it AI for the past few weeks. So in the realm of mental health, sometimes you gotta just say fuck it. You know what I'm saying? So we're gonna get into this song right here. This is an AI song by Nick Hustle called Running Out of Fucks to Give. So let's get into it, y'all. Let's go. Let's go. Let's go. Let's go.
I'm running out of fucks to give. Running,
I like it.
running. I'm running out of fucks to give. Gave one to my girl, gave another to a friend, even gave one to my ex. I don't got any more fucks left. After seeing my energy burned up, some lessons learned tough. Don't be generous with your fucks. Ooh. Running, running. I'm running out of fucks to give. Running, running, running out of fucks to give. I'm slowly running out of the shits too much of it can get you. I got bills, I got shit to do. Too many fucks to give in my whole life. I don't have any to give you.
Da-da-da-da-da, da-da. Hey, I'm just gonna say it right now, man. That's AI though, right there. But that's one of them ones right there, man. I'm running out of fucks to give. You know what I'm saying? We all been there before. We all done been there before though. We all run out of fucks to give though. You know what I'm saying? So that's a
What an
slapper.
inspiring song, Big J.
I love that song.
That's right. That's right. Most definitely.
Is that in your rotation when it
I
comes to
love that song.
you putting that in your song rotation on that's
Ain't
on the
no.
playlist?
I was banging it yesterday while I was straightening up at the house.
Running.
Man, hey, sometimes it be like that though. You know what I mean?
Love that for you, Big J. Love that for you. So that's a slapper. That's one of them ones. Got
That's one
it.
of them. That's one of them ones right now. You know what I'm saying? So we gonna keep, and we gonna keep the show moving along. No, let's go.
Come on, let's go.
Welcome to the pop off, y'all. Welcome to the pop off. So this segment, I'm just gonna list some. There are gonna be some questions, but I want the first thing off the top of your head. Okay, to my room.
Okay.
You there with me?
Yes.
Oh, I can't hear you.
I hear her.
You hear her?
Yeah.
Okay. Wait, say something.
Hello.
Damn, I can't hear her, Big J.
Why?
What happened?
I don't know.
Oh, that's that iPhone stuff.
Anyways. All right, I'm just gonna keep spitting it. So I'm gonna list some questions. I know you're not exactly a mental health provider, but you're you're in the field. You've seen a lot, you've heard a lot, you deal directly with, other professionals like yourself. So off of what you know best, from your experience, I just want the first thing that comes to your mind.
Okay.
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 Number one, how would you define trauma? What's your definition?
Deep hurt.
Repeat that, Big J.
She said
We gotta
deep
fix
hurt.
this.
Yeah, pop, just go out and come back in, pop. Just go back out
Okay.
real quick and then come back in. It should be fixed. Yeah. Okay, well, I'm gonna ask you this though. As far as with trauma, since Pop brought up trauma, when she come back in, we'll just pause it though, and then you can answer her question again. Though, okay, PTSD recovery is never a straight line. How do you build a predictable billing model for an unpredictable illness? Okay, we're gonna pause that. She popping back in.
Okay.
All right.
Okay. Yes.
Hello.
So trauma. I can hear you.
I can hear you too.
What was your definition? How you would define trauma?
I called it deep. I said deep rooted hurt.
Deep rooted hurt.
I lost both of you guys. Damn it.
I'm a little robotic.
Oh yeah. Yeah, Pop lost us again. She gonna come back in and she said she couldn't hear neither one of us.
Okay.
There she go. Let me see.
As soon as you move me, Big J, I stop hearing.
Can you hear?
I can't hear you right now. I heard, but the second you flipped me, I lost all.
Can you hear?
Nope, I don't hear nothing.
Running out of function again.
Thank you guys for holding it down while we take care of these technical difficulties.
All right, let me see. Can you hear, Pop?
Nope, I gotta hop out real quick.
Yeah, you gotta hop out. You got the other one open still too. All right, she gonna come back in. Let me see. Kick from studio. She out right there. Okay, so look, I think she go again.
It's gonna work. This one's gonna work. Okay. Everyone there?
Yep.
Yes.
Yes. This one's gonna work. This one's gonna
Okay.
work. Okay.
All right,
All
good.
right. Are we on to the next question, or did you ask? I heard you
No,
ask
no,
what a
no. Run
question.
it. No, run it back again. Pop, ask her the question again so we can have a straight dialogue with it.
Okay. Pop off questions. How would you define trauma?
I would define trauma as deep rooted hurt.
Deep rooted hurt. Okay. So as far as when it comes to men, what role should communities play in prevention?
First of all, I think that when it comes to men and mental health, we should um, always allow men to feel that there is a safe space for them to talk about their feelings. Because, like, to your point earlier when we were talking and you were like, oh, I don't want to be a punk, and that telling younger kids that we used to do it, and we always used to do it, but what it does is teaches them that, yeah, when you're feeling uncomfortable or you're super sad, just shut up and don't say anything about it, and then all that does is turn into deep rooted hurt.
Facts.
Mm.
Yeah.
That's true.
So, you know,
How
holding
would you?
things in, no good, no bueno.
No bueno.
That's right. How would you say trauma shows up differently in men?
Oh, I would say that trauma in men is going to show up differently because they're usually supposed to be the head of a household, and they have all of these people that are supposed to be depending on them, and if they can't even depend on themselves, then it's kind of like we start to get the broken homes, and there's a lot of pressure on men. It is.
Right.
It's a lot of pressure on
Mhm.
them.
I can attest to that. Yes.
Yeah.
Okay. So, why do so many men struggle to seek help when they're experiencing emotional distress?
Embarrassment, and also just family. If your family never got therapy, your dad never went to therapy, you never seen your mom go to therapy, you never seen your uncle or your cousin go to therapy, then why would you? It's like some families, they believe in therapy, some families believe in just going to church. I believe you should do both. So it's
Mhm.
just it really depends on how you grew up. But now it's like we have social media and we have all these people talking about it, and mental health is just out there. We have a whole month now for men. So you would think that people would be a little bit more open to getting the help that they need and not as embarrassed or uncomfortable about it like how it used to be, you know?
Right.
That's
Right.
right.
Tamara, I'm gonna ask you real quick to go out and come back in. Just go out and come back in so
Okay.
to see if it'll fix the freezing up. So because she giving us some good information, and I want her to be looking all the way right when you have
That's
talking about
right. Bottom right, there should be an arrow.
yeah. Just go out the link and then come back in. She
It's
look
like a
like she's
peach.
moving right now though.
Right.
She moving in real time now. Let me see. Yeah, she moving in real time. I think we probably
You might be good now.
yeah, we might be good now. Okay. Go for
Okay.
it, Pop.
You there with me, Tamara? Can you hear me?
No, she can't hear us.
Oh man,
Oh,
Tamara.
there she go. There she goes. She coming back in.
Mm-hmm.
Hey.
I was here too. Oh.
Can you hear us?
Yes.
Okay.
It's still a little slow, but I can hear you.
Okay, let's do it.
Okay. What are some signs that someone may be carrying unresolved trauma?
I would say some signs that a person is carrying unhealed trauma would be a certain, like when they have outbursts of just getting angry for things, and you're just kind of, you might be talking to somebody and you say one thing and they're just like, what? Usually all of that is from something else that it has, and it usually has nothing to do with you. I had to learn that the hard way.
That's a fact. I've been saying that a lot lately, actually. Like when I'm dealing with like the public, I'm like, that had nothing to do with me.
It has nothing to do with you.
Nothing to do with me at all. I'm like, you know what I'm saying? Like, just gotta take it on the chin sometimes.
Yeah.
What systemic barriers prevent people from receiving the help they need?
Well, first of all, healthcare is expensive. Insurance is expensive. If you don't have a lot of money, do you pay your car note, or do you pay your health insurance? Like some people literally go without health insurance. So that's a systematic reason for people to not get the help that they need, because you make healthcare so unaffordable. It's still unaffordable.
For sure.
For sure. That's number one right
That's
there.
That's number one. It's the money.
Okay.
Providers got to get paid, and you guys don't want to pay for it, but then you want to collect people's premiums. So it's just, yeah.
What are some changes you want to see in mental health care in the next decade?
What I want to see is just the stigma around it just completely go away. I feel like it is starting to go away. Like, it doesn't mean you're crazy just because you have a therapist. I have a therapist, and maybe I am crazy, but everybody is a therapist.
We all are a little bit.
Yeah, I always say that. We all are a little bit crazy, everybody. And if you say you're not, I don't believe you.
Man.
That's sad. So if you were speaking to, if there was a gentleman right in front of you who needed care but won't get it, what would you tell him right now?
Tell me.
If you need care and you feel like you don't need, if you need care and you think you don't need it, but everyone around you is saying, hey, maybe you should go and talk to somebody. I would tell you that if you want to have a higher quality of life, you should try everything. And getting a therapist is one of those things that you should try. I think everybody should try it.
Right.
Okay.
Right. And like how you mentioned church, a lot of churches also have programs to where they have, some churches have therapists there that you can go talk to even at the church.
It's true.
And not just the pastor.
If you're a spiritual person, like I've worked for some therapists who are, you got like I said, it's like a dating thing. You can find a therapist who is not spiritual. Some people are not into that. And you can find therapists who are strictly about the science of it all. And you can find people who create a safe space for you to talk about your feelings with spirituality and the clinical side, science side to it. I think it's good to have both if you're a spiritual person. When I was married, my ex-husband and I, we got therapy through the church, but we also had a real therapist. Not real. I'm not going to say not real, because a pastor can still be a therapist, a licensed therapist. We also got a licensed therapist to go along with that. And, I just feel like you got to try everything. You got to try everything to make the quality of your life and better. And so just like if you're sick, you go to the doctor. If you're not feeling good in your head and you're feeling stressed out and sad and depressed damn near every day, go get some help. It's okay.
It definitely is.
It's okay.
Yep. I think in this day and age, though, like with the generation of kids nowadays, I think a lot of them, I think it's a lot more information out about mental health and protecting it and learning about it and learning triggers and learning different things, though. So especially from when I was younger, I didn't really see no kind of stuff like this.
Me either.
You know what I'm saying? When I was young.
Yeah.
So to see that and to actually see some people take advantage of that, especially youngsters, I mean, it's definitely a good thing. It's still a fight that needs to be had for more people to get involved with it. And even us as men that came up in traumatic situations, even if we don't go seek help, when we talking to our younger generation, to let them know, like, man, it's okay. It might be too late for me. You or a person might feel like that, but you go talk to somebody. Don't hold this in. Or even if you want to talk to me, because even a person that's been through something that's true, you can learn something from everybody, basically. You know what I'm saying? Even somebody that's messing up, you know what I'm saying, or somebody that's doing the right thing. You could take a lesson both ways.
Completely agree.
Yeah.
I agree with that as well. You can always learn from somebody. You can learn from somebody how to, oh, I could navigate this like this. Or you could learn of, I'm never doing that. I'm not going that direction. You can learn both sides. You know what I'm
Yeah.
saying? I feel like I'm the baby of the family, right? Of my family. So I got the learning from both. I've definitely had some people I've looked up to, and I've also had a lot of observation of like, I don't want that.
Mm-hmm.
And it's funny because like my parents always told me, they're like, I like one thing about you is you just have your own mind and you're just gonna do what you want to do. Like, don't change that. And I don't. I'm like, I'm not doing that. Maybe, I'm all set with that, So I've always been like that. So blessing, curse, I don't know, like, but
That's a blessing for sure, for
Blessing, for
sure.
sure.
man, because
That's
like no
why,
matter
yeah.
what, if like even like peer pressure wasn't like a huge thing for me, because if I didn't want to do it, I'm not doing it.
Yeah.
Right. Right.
So them ass whoopings was all needed when they were needed. Because it was
Because
like
you wanted to do it when you did it. You know what I'm saying?
exactly. I wasn't playing nobody. I wasn't playing no one.
Man.
But for
Yeah.
sure, for sure. Did you have something, Big J?
Yeah, and that's like me coming up. Like I seen a lot of alcoholics, you know what I'm saying, in my family and around. So like I don't really drink that much. I'm more of a social drinker. I probably drink once a month. If that, I got a couple bottles that's been sitting up for about 6 months, 6-7 months. You know what I mean? You know what I mean?
Yeah.
But that's how, because I look the same way like you said, Pop. I kind of looked at them like, man, I'm not trying to be doing all that, falling asleep in the car crashes, can't walk in the house, just all kind of different things though,
That part.
yeah.
That part. So, what are the biggest gaps in support before someone reaches the breaking point? Like, what are some of the biggest gaps you see in support?
I would say a lot of times gaps in treatment. Like say if someone is coming and getting treatment consistently and then they kind of like fall off the wagon per se, and now you have like this time to not be talking to your therapist. And so in substance and alcohol abuse is one of those things where you cannot take those gaps in those times. If you're just seeing a therapist because you have depression, sometimes they want you to go a month and then come and see me next month and let's see how you feel, but it just depends on what you have going on and what your diagnosis is.
Right. Let me ask you this. When it comes to the medication though, I've seen and knew people that have, dealt with mental health issues, depression and different things like that. And two of them that I've seen, they tried to push, medicine, like drugs on them and stuff like that, antidepressants and stuff like that, but they didn't take them.
Mm-hmm.
They coped and figured it out on their own and got to a better place.
Mm-hmm.
I see like in a lot of situations, a lot of these doctors and therapists try to push, the medicine at people. And that, I don't believe medicine really helps like that though. You know what I mean? Because it's a side effect to to taking this? Oh, it's gonna make me drowsy, but it's messing up my liver and doing this and doing that.
Mm-hmm.
So do you think the medication side of it is like 100% beneficial to people?
So, so psychiatrists are the only ones who can actually prescribe medicine, right? So if you have, like, say if you have a therapist, they can't give you medicine anyway. So you just see you're seeing your therapist. They're not allowed. They're not a doctor. They can't give you medication.
Okay.
But if your therapist has been seeing you for a year or two, and they're noticing some different things, and they refer you to a psychiatrist, and they get blood work done, and chemically something is off that requires medication, I'm an advocate for you need to get the medication.
Okay.
But everybody doesn't require medication. It's literally a blood test that that they take to see where your levels are low, high, and it's a bunch of different stuff. I don't know because I'm not a clinician, but
Right.
that is a piece of getting medication. And what I would say is that I've seen people get medication and it not work. But that's usually because the psychiatrist needs to try different cocktails of different things. They're basically playing with your brain and the chemicals and the medicine. That's what they're doing, trying to get this perfect balance. And some people have to have it, or they won't be able to function in society. Not everybody, but some people.
Some people need it, right?
Yep.
Mm-hmm. First thing that came to my mind was schizophrenia when you said that.
People have to have it. Yeah.
Yeah. Man. Okay. Have you how can we better support individuals returning home from incarceration when it comes to mental challenges?
Mm-hmm. I would say, first of all, right away, finding that right provider for you, and I know it's going to take a team of people. We just talked about that. It's going to take a team of people. So let's say you have, like an advocate, a guy who just got out of prison, and now he has like an older dude who he's younger, and the older dude is coming from prison and has been out of prison long enough, and now he's talking to him, kind of like my friends who did the nonprofit, and they're doing that. Cool, that's great. That person still needs a professional provider, and they still may need some spiritual guidance. It is a team thing, and it has to. I feel like it has to all be thrown at them in the beginning. They got to feel so loved and so cared about and so paid attention to. You know what I mean? Because once you've been put into prison, you probably feel thrown away.
Mm-hmm. For sure, that's a fact.
Man.
Yeah, we all need people.
That's a fact.
Okay. That's
Most
a fact.
definitely. Most definitely.
So I know I want to go over some of the resources you brought here with us. Big J, do you have any other questions before we touch on that?
Yeah, I do have a question about PTSD. Okay, PTSD recovery is never a straight line. How do you build a predictable billing model for an unpredictable illness?
Yeah. So yeah, PTSD, of course, usually you're going to get a lot of that with people from the military, but it could be from PTSD from anything, right? So like when it comes to the billing piece of that, they're going to have diagnoses that are not going to be like a PTSD diagnosis. There's going to be something else. There's going to be, I don't know, OCD. There's going to be a different diagnosis. And based off of what that diagnosis is at that time, that's how the treatment is done. So if I'm treating you for depression now, that doesn't mean I'm going to be treating you for depression in 6 months. Maybe now you've had an episode, and so now I'm treating you for that. So I'm only giving this information based off of when I do the billing for these providers and what I see going to the insurance company as far as medical records.
Right.
Okay.
So diagnoses are switched around in different places to bill to the insurance company depending on what they got going on at that time.
Oh, that's
because even if you have a depression diagnosis on a claim form, and that's what you send to the insurance company electronically,
right,
there's boxes on there, and there's boxes that tell you everything about this person, and there's diagnosis, and this is coding. You know, a lot of people you might hear saying, "Oh, medical billing and coding." Like, what is that? Because there's codes for what that diagnosis is, and if they're switched around, that's how they're treating them. Oh, today I might be treating this person for their OCD, but next week I might be treating them for their depression. So you put the diagnoses into 1, 2, 3, 4, 5 order. I think it's like 6 or 7 on the claim form. And some people have multiple diagnoses, and some people might be just getting treated for one thing.
That's interesting. Look, I got one more question. What is the single biggest myth, if any, about healthcare administration that we need to destroy to fix the system?
We need to fight these bigger companies, and hold them accountable for taking people's money, because that's what they're doing. They're taking those premiums every month. People are paying, and then you are telling them, "No, I'm not going to pay for your services." I know for a fact that I went years having insurance and not using it for anything but a primary care appointment. So what about all that money? You know, and there's so many people who do that. There's healthy people who have health insurance, and that's what the extra money is for, is to take care of the sick people. So we have to hold them accountable. And I mean, it's all going to start politically. That's what it is. In the state of California, I just learned something really, really cool the other day. I didn't know. Basically, there's a program here called in-home health support. And it basically pays for you to take care of your family member who's older. And I went to a conference and they were talking about it, and I just didn't understand that basically, like, the state of California, they do fight to keep their programs. They literally made people a union. They created a union out of healthcare providers. These are not real healthcare providers. These are people who are taking care of their family members, taking care of their kid who may be autistic. So you can't go to work all day long because you have to take care of your kid, or you're taking care of your mom, or you're taking care of your dad or your husband, whatever. The state of California, they actually pay people to take care of their family members. And all of those people who are doing the work are a union. And Trump tried to it's only 5 states left that have this program. And Trump tried to tear that down as well, but he couldn't do it in California because we have a union.
Yep. And the good thing about the IHSS too is you can start off working for, like helping your mother, grandmother, grandfather, and you can also branch out and work for other people too. They have networks.
Yes, I just learned all this the other day. I didn't know that, because in Georgia, which is where I come from, they didn't have that program. So when I learned about it, I'm like, wow. And then the way that they're structuring it is preventing politicians from shutting it down. Yeah, they're smart. They have some political influence.
Yeah, for sure. Let's get into these resources.
Yes. So holding some of the companies accountable, not only would be politically, but speaking out.
Yes.
I feel like it's so hard to battle something like this politically.
It really is, but there's other people who are doing the work, and once you get with them, they can help you to tell you where conferences are a big deal. I try to go to a conference at least once or twice a year in regards to healthcare administration. So it's like, if you really want to, it's healthcare. So you have to be in that world of healthcare, because that's what it's about. I mean, mental health is healthcare.
Right.
So, there's people that's doing work like this. It's like you have to all kind of get together. So if you go to conferences and you just talk to people, they'll direct you on where you can help. There's always something for people like us who want to help do.
Okay.
Do. Yeah, there's always something for us to do.
Okay. I can actually, one of your resources, Affordable Healthcare Georgia. You want me to bring that up?
Yeah.
Okay, let me bring it up. Hold on. Okay, there we go.
Yep, they help you get health insurance. So there's lots of places. This is in Georgia, but there's companies like this that will help you find the right policy for you, because it's expensive.
Right. Is there anything in here you want me to click on?
I would rather for you go to the one. Did you guys get the Just for Men behavioral health?
All right, let me go. Let me find it. Let's have some dialogue while I'm looking for it. Just for man.
Just for men behavioral health. And I know you mentioned that you reached out to some of your colleagues um who are clinicians or they're in the
Yes.
field, and they were more than happy to help get you some
Yes.
of these resources or share their knowledge.
Yes.
I think that's
One,
amazing.
yeah. The one lady in particular that I was telling you about, her name is Ashley.
Hmm.
And she is licensed to see patients in Georgia and in Missouri.
Okay. Just for
Um,
men, men's therapy destination in Atlanta. That's right. Serving all of Georgia through in person and telehealth services. That's right.
that's another thing. Telehealth services are big now, and I mean that didn't start until like 2020, around COVID time. Before that, people barely ever did telehealth services, but now it's like no excuse. You can have therapy in your home if that's what you want to do. If you want to go to an office, find a provider that allows you to come to their office. But a lot of providers are doing telehealth services because they also can be at home and have home offices and see patients from home now. And they still are held to the same standards, especially when you're billing insurance. You still have to be HIPAA compliant. You still have to have certain types of software. It's not like you're just doing a phone call on FaceTime. It's real.
Mhm.
Everybody who does this has to be super professional.
And look, for the people that don't know what HIPAA is, explain it to them.
So that's So basically, HIPAA is basically the law of protecting your personal and private information and your medical records. We've all heard of like maybe a celebrity. Oh, she's at the hospital having a baby, and now that nurse is fired because you can't tell people about people's healthcare situations,
Right.
on social platforms. Like I can't come in here and tell you about an actual patient, and just put them on blast. So that's created to protect people. So
Mhm.
say if you're doing a telehealth visit at home, the software that we use is software that's protecting you for that. So no
Right.
one can, click into and accidentally hear whatever you have going on, or, it's just everything is secure because it's private.
Right. Yep.
It's private.
That's right. Treatment and recovery scholarship. Ooh, this
Yeah,
sounds like
that's a
money.
good one. Yeah.
Okay, so we know that getting professional mental health care isn't always easy. Cost isn't always one of the biggest barriers. Um, that's right. The program helps individual access mental health care by providing financial support for therapy or counseling. Scholarship awards typically range from $65 to $100. Funds may fully or partially cover individual therapy or counseling sessions with a licensed mental health provider.
Hmm.
Okay, and it breaks down who can apply, application process.
Hmm.
That's right. Okay.
Hmm.
Is this in a
Oh, that,
certain state as well, or is it
I believe that is just going to no, because wherever you because they're just giving you the money. Now you see a licensed professional counselor wherever you see them at, and so yeah, that's just actual money. I don't think you have to live in a certain state for that.
okay.
mm-hmm,
So anybody, right? Anybody could tap
Yeah.
into this. Yep.
Hmm.
free telehealth therapy sessions, free group sessions with peers? Okay.
Hmm.
Okay. Good resource to have.
For sure. For sure. You can also donate too if you want.
Exactly.
Yeah.
Yep.
Treatment and recovery scholarship.
They got stories on here.
Hmm.
Yeah, it's
Pride kept
different.
me
Oh,
alive.
let me go back. My bad. Pop, he was reading.
No, you're good. A letter to anyone who feels lost. The world is better with you in it. Okay. Metaphors of art being the art of being indirect.
Hmm. Yeah, this is dope. I'm loving this live right here though, because it's a lot of good information that was put
Yeah.
out there. and these are some good resources that people can actually tap into and get a little bit more information, especially if
Yeah.
they looking for some kind of help.
I would be so thankful if just one person was like, "Oh, well, let me just go get some help." Just one person.
For
You
sure,
know,
for sure.
so they had scholarships. There were some resources in Georgia for those who are tapping in who are in Georgia.
Mhm.
Um, something for the men was they had. I love
Yeah,
that. I love that because it's like they do a lot, or just people in general do a lot for women when they can, but something mental health for the men.
Men.
we need that.
Please, let's keep talking about that for
Mm-hmm. Yep.
sure. Because
Agreed.
I feel like even when it comes to like women in like our circle, like they talk about how like women when they fall out with their friends, right? It could be so harsh. Well, yeah, because we are like you're someone we confide in. We're someone we cry with. You're
Yeah.
someone
Emotion,
we are very like when it comes to
emotional.
our women's circle, like we rely on so many different things from a female friend. You know what I'm
Yeah.
saying? Like it's like
They're
not
important.
just
Yeah.
yeah. So it's like we have that depth when it comes to having our friendships, but like guys, it's just something so
Man,
different. I don't even know what it says. Like you watching football this week. What?
And that's it.
That's
right,
And
it.
that's why when he was saying that him and his cousins were sitting there and they were just talking about their, like, I love to hear men talking about what's
right.
going on in their life with each other. That's
Hmm.
amazing. That's
Yeah,
amazing. You guys are being there for each other. That's what it's all about. Because sometimes you may have the better advice for this man over
right,
whatever he's going to do himself that was going to be absolutely wrong.
you
right.
know or
And
that one person they call for the bullshit.
Yeah.
Who it's just like, no, don't
right,
listen to him this time.
Hmm. Please.
you
right.
know
And then when you dealing with somebody, it's like one of my cousins in particular, like me and him talk every single day about about all kind of shit. And if I call him and I'm not sounding right, he be like, "Cuz, are you all right? Everything good?" And I do the same thing with him. Though, like, "You good, man? You having a good day?" And whether he is or not, we have that conversation and stuff like that though. So yeah, it's definitely important to stay tapped in, and just as a man to realize that, express yourself, express your emotions and how you feeling. Don't be scared. And if a person can't, do it positively though. And if a person can't take that, then that's not the person to be around you.
Yeah.
You know what I
Agreed.
mean? That's a
for
fact.
sure, for sure. Were there
That's a
some
fact.
other resources up there too, Big J?
um Let me see.
You had that one you said your colleagues started, right?
Hmm.
Oh yeah, let me go to that one. We can pull that one up. Let me see. That was the Black Girls. Yep, blackgirls.com. Hold on. Let me take that off.
Therapyforblackgirls.com.
Yeah, therapyforblackgirls.com. Okay, let me share this. And that's something like, and we do a best way to paint event. We just started. We did our first one last month. We're doing another one next month coming up, and we want to tailor it in the realm, for mental health. And we actually trying to find a program that we can, send some support to, through what we doing with the best way to paint. Hold on, let me get this up. Uh,
Yeah, she was so I was, remember we were talking about the paint. I think that's amazing because I like to paint.
Oh yeah, that's right.
But yeah, I love painting, but the thing about it is also it's a therapy.
yeah,
Absolutely.
It's a therapy. I literally had a therapist who that's what she would do with her girls when they would come to eat. When I worked at the eating disorder facility, that was one of her things that she would do, was painting. Yeah.
Right. And we figured an activity, for like just not necessarily our age group, but that like around us. You know
That's
what I'm
so fun.
saying?
It sounds so fun. I love that.
Yeah, whoever needs an activity, just something midday, doesn't gotta break the bank type
Mhm.
deal, you know.
Yep. I'm
Black
there for it.
girls
I like that.
thriving. Start here, ready to get started with therapy. Our guide will help you with the first steps. Okay, and it has a guide. Get your guide. I love that. It's not so much pressure. It's like
Mhm.
we're here to help.
Yeah. Put your email in and get your guide.
Mhm.
Featured
Oh,
in
and
several
so you're
different.
definitely invited to our best way to paint event too. Though, if you're out here
Yeah,
in
I
Plano,
already said I wanted to go to that. I already.
for sure, for sure.
We'll save you a spot.
Yes,
Yep.
please.
Successful therapy depends on a great client therapist fit. I love that. I
Yeah.
love that. Find a therapist to join as a therapist. Ooh. And you said your colleagues started this? Two of your colleagues, right?
No, what? So basically, one of the girls who I worked with, she is like. So basically, they help run this. So this is just like a system because you can go on psychology. .com, I think it is. Yes, psychology.com, and you can find a therapist. That's usually how people find therapists. They just go to psychology.com and they just look for a therapist, and you can break it down by specialties and just different things, insurance, whatever. But they're doing this only strictly for Black girls. Like all the therapists, the whole that are in this, if you put your email in there, the information that's going to be spit out to you is going to be people who are Black.
Shout out to them. That's dope.
So
Holding Space Foundation.
That's dope.
That's right.
Oh, you was trying to read that, Pop. Gonna get it off.
No, it's all right. I was scanning over the whole thing, but Holding Space Foundation, founded in 2021 by Dr. Joy Harden, Bradford of the Therapy for Black Girls. The Holding Space Foundation was established to address the mental health needs of Black women and girls amid the pandemic and racial violence. The Holding Space Foundation offers group healing spaces, professional training, and community education, all aimed at providing culturally responsive services that empower Black women and girls to tend to their mental well being and combat sexism in misogynoir. That's
Yep.
right.
Yeah.
That's
We know you
right.
did. We know you did good in English class, Pop.
Me?
Yeah. You got that word right off the bat. But yeah, that's
Did
dope.
I?
Yeah,
I was waiting for someone to correct me. I was like,
man. Yeah, that's dope right there, though. I love.
Westward
Let
Heels.
me ask you this question though. Do you think people when a person say they healed? Because me and Pop have a little thing about when people say they healed, though, right? Do you think people full of cow manure when they say they're healed?
I mean, some people are. If they did the work, then maybe they are.
Right,
But it's still going to deserve management.
right. Yeah, that's because that's what I believe. I think it's a
Yeah.
ongoing process though
Yeah.
of healing and stuff though. I don't think you're never just 100% healed, but you could be in the realm
In a
of
better place.
right. You know what I'm
I
saying?
think when someone's like, "Hey, I'm healed," I feel like that's a red flag. I
Red
get
flag.
scared.
Most definitely, most
Like, if you
definitely.
telling me this unprovoked,
Mm-hmm. Mm-hmm.
like,
Yeah,
are you now?
yeah.
No judgment, you know what I'm saying? But it's just like it's a
She said,
thing
"Are
where
you
I'm like,
now?"
you know what I'm saying? Like, I don't think it's a linear process, like Big J was saying.
Right.
You know, it's kind of like a. She's like, that's great, but it deserves management.
It does.
For
She put
sure.
it perfectly. She put it perfectly. That's right. That's
So
right.
this I'm very grateful for you tapping in with us on this topic and dropping your expertise on us. And what I want to do is when we get back to our sit down, our live
In
sessions,
person.
podcast sessions, in persons, we definitely want to have you come on and we can get a little bit more in depth on a mental health topic and your professionalism in it. Yeah, this was dope, man. I really liked
Yeah.
this and enjoyed
Yeah.
this right here.
I did
And
too. I'm so happy to be here.
now I know you said you are an advocate for many things in your field, especially when it comes to getting people the right care, and you said there's money out there,
It is.
right? How do we support you in your mission, because like it's like you're almost like that middle piece, like people in your profession are like that middle piece for us who are trying to spread the awareness, but we're still trying to figure out what direction to go to along the way, you know what I'm saying? So
Yeah.
is there any way we can support you or the movement in the process when it comes to like spreading like the billing part? I feel like that's huge, like holding these insurance companies accountable, like whatever that mission might be, girl. What can we do?
Mm-hmm. I've kind of thought about that. I don't know for sure how to go about getting someone to help with what it is that I actually want to do, but what it is that I want to do is just be more of like informational to the community about insurance and how it all really works and what moves to make with it, because I know that people don't understand it.
That's a fact.
I literally, everybody in my family, all my friends, they always call me when they get a job, and they're always like, look at my insurance packet, And
I'm gonna start calling you.
I love that, because you want to make good decisions about that stuff, especially the older that you get. But regardless, if you're paying for health insurance, you want to have the best plan. It's your money and it's your life. The insurance is to take care of you. So, yeah.
For sure.
Yeah. So any of that information that you come across moving forward, and you want us to share it, we'll definitely you can definitely shoot it our way, and we'll share it for sure.
Okay. Thank you.
Yeah.
Yes.
So on that note, anything else, Pop?
I'm grateful. I'm grateful for this conversation. I love that you kind of spur the moment was like, yeah, I remember I met you randomly.
Yeah, it was so fun that night. That was so much fun.
And I was like, would you want to come on my podcast?
So fun.
Yeah. So I'm grateful for it. I'm grateful.
Yeah.
I'm grateful.
I was telling everybody, it was like, what? You're doing a podcast? I'm like, girl, can you believe it?
And you were so open to it. Like, I'm glad, like, that wasn't even, I wouldn't say that wasn't the setting for the conversation that we had, but it was like, as soon as we got on the same page of like mental health, it was like we had a crowd of people around us.
Yeah, we were just out there talking, just me and her locked in. Yeah.
So I'm glad. Thank you for sharing that space with me and being so open to it, and just like being that source of wisdom along with doing it. I'm super grateful for that. Thank you for coming on here and not knowing me from a can of paint.
No, I know good energy. I know good energy when I'm around it. Like, I felt that, so I already knew.
I appreciate it. I really appreciate it. And we're definitely going to have you for the sit down, because we're going to be battling so many more, obstacles along the way and trying to figure this thing out. So I can't wait to have you back already.
Yeah, for sure. And my friend Ashley, I told her about you, so she wants to get in on this in the month of June too. So just letting you know that.
And she's a clinician, she's
a clinician. Yeah.
Oh yeah, I seen the email.
Yeah. Okay. Yeah. For sure. We'll definitely.
She's good. And she's real good. She's real good.
Let's do it.
Yep.
Let's do it.
That's like, is it anywhere like where people could contact you at, if that's what you if you want people to contact you or getting reach out?
Yeah. So I have an email, and the email is MediCollect. It's ME. Hold on, let me make sure I spell this right. I don't want to.
Oh, I'm gonna clip this and then I'll put it up too, though. So yeah.
Okay. So it's MediCollect2004@gmail.com.
Okay, got you. So if anybody looking for resources with billing, you want to get that money,
that's right. I'm your girl.
Tap in. Mm-hmm. And on that note, again, thank you. And this is Best Way to Smoke, Unfiltered. I'm Big J. Make sure you stay elevated at all time.
Be Poppy Professional Hype Woman, and thank you again to Myra. We'll see you next time.
Thank you guys for having me. Have a good night.
All right, you too.
Bye.
Yeah, you know me, got the tree, got the hemp, got the flare. I'm gon' lean in this chair, about to put this in the air. A little bit of that best way to smoke in the air, nigga.